Okay, so, we've been reading over and over and over again about this Medicaid mess that we have in the state of Louisiana. And the latest one is the story about even the most basic information that the legislative auditor needs could not. I mean, all he needed was a little more information, the info to combat fraud and save the taxpayers money, a little more oversight, a little more information. There was a proposal by Tony Bacala that was going through Judiciary A to give the legislative auditor access to income tax data to check Medicaid eligibility. Seems like a simple request. Hey, give me a little more information and I'll be able to enforce the law and try to fight the fraud and abuse in the system. Nope. Committee voted 5-3. The House approved the proposal, getting some good legislation out of the House, Louisiana House, but it gets over to the Senate. It's like the graveyard of good legislation. And so that reminded me of an article I read a little while back by Chris Jacobs, who is an expert in these things. And we are so pleased and happy to have Chris Jacobs on the line with us. Hey, Chris, welcome to the Ross Report.
Great to be with you.
I read that article, and I love the way you start the article. As the old saying goes, when you're in a hole, stop digging. And unfortunately, our governor has forgotten how to do that. You have really drilled down into the problems with this Medicaid expansion. Give us a little rundown of what you see as the really primary problems with it.
Well, there are two problems we've examined thus far. The first that you just talked about in the legislation that just got voted down is eligibility, and people making too much money who are getting taxpayer-funded Medicaid, making six-figure incomes. Okay, there were almost 1,700 people making six-figure incomes that were receiving taxpayer-funded Medicaid rather. I don't think the hardworking citizens of Acadiana appreciate that.
No, I don't think so either. And I can tell you it's infuriating for a lot of people because I have also read some of the statistics that some folks have really had trouble getting help because of this flooding of the rolls with people who weren't really eligible.
That's true. And the second problem we've seen is individuals who are possibly eligible for the program, but they are dropping their private coverage to go on to the Medicaid rolls. That's a waste of taxpayer dollars, and that's inefficient. Why are we spending scarce taxpayer dollars to provide health coverage to people who already had insurance?
Exactly. So Medicaid expansion, well, it looks like a really nice thing to do, and you got a big heart and all that kind of stuff. But when you have so many people on the rolls that aren't eligible, that really should not be on the rolls, and you have the health department fighting the legislative auditor, not only the health department, but now the legislature too, how do you overcome that opposition?
I think it's difficult, at least in the short term. I mean, in the longer term, the Department of Health's line behind all of this is, well, Medicaid expansion isn't costing the state money because the federal government's paying for all of it. Well, last I checked, I certainly wrote a check to the IRS
oh, you bet.
On April 15th, and I'm guessing most of your listeners did. So that money all comes from somewhere, and this isn't being good stewards of taxpayer dollars to be spending money on ineligible people or people who already had health insurance previously.
And the able-bodied adults that have been put on the rolls, keeping other people from getting. I mean, the doctors can only handle so many patients at a time, and of course the reimbursement is not that great either. And so that really puts people on a waiting list who maybe need care immediately.
That's true as well. And this is the other problem, is that the federal government is giving states 50 to 75 cents on the dollar to cover individuals with disabilities, many of whom have to wait for personal care services because states are expanding to their able-bodied adults population. Able-bodied adults get 90 cents on the dollar from the federal government, whereas individuals with disabilities, the state only gets 50 to 75 cents on a dollar. Why do we have a law that prioritizes able-bodied adults over individuals with disabilities.
Oh, that's crazy. I saw in your article also that the Department of Health is advertising a 7-year wait for individuals with developmental disabilities to be evaluated for care. I mean, that's insane.
They've worked to reduce some of that waiting list, but there's still tens of thousands of people because of putting in public records requests. And the health secretary said, well, we've eliminated the waiting list. So I filed a public records request with the Department of Health. Well, they said they just called it, instead of having a waiting list now, well, it's a registry for services.
Oh, come on.
Well, that's seriously, that's what they told me.
Oh, my God.
And they've reduced the waiting list somewhat for some individuals with developmental disabilities, but there are still, I believe, off the top of my head, about 15,000 people waiting for services while we're expanding Medicaid to the able-bodied adults.
How long can this be sustained? I mean, it's already eating up about almost half of the state budget. How long can this go on, Chris? Really?
Well, you're exactly right. I mean, it's more than half of the state budget. More importantly, or it's almost half of the state budget. More importantly, the federal government's got $22 trillion in debt and climbing.
Yeah.
And where's most of that debt coming from? It's coming from Medicare and Medicaid and our health care entitlements. Margaret Thatcher famously said the problem with socialism is that they eventually run out of other people's money. We're getting
to that point, right?
Very quickly.
Yeah, you're right.
Yep.
Do you think that would a different government, would we have a chance to actually reform some of this stuff? Because it doesn't seem that this one is very willing to do that. I mean, when they got in there and fought a good government measure such as this, and the legislative auditor says he needs the tools to combat fraud and waste, and they step in, the governor and his minions in the Senate step in and kill it. I mean, what hope do we have of getting any handle on this?
Sure, and we've put out, I wrote a policy paper early last year. It's on the Pelican Institute's website. Should freeze enrollment in Medicaid expansion, kind of stop the fiscal bleeding, and then go back and try to get a waiver from Washington to allow additional flexibility. Other states like Rhode Island have accomplished this flexibility by providing better care and eliminating some of the red tape. Could actually reduce health costs and provide better care to the individuals with disabilities and the vulnerable populations for whom Medicaid was originally designed.
So you have, in that paper, you've outlined some of the steps that could be taken to actually get a handle on this mess.
Absolutely, yes.
You know, I saw in your article, too, that the whole thing, the enrollment explosion, as you've said, puts Louisiana's budget in even greater peril. The thing that the enrollment exceeding 300,000 would reduce the savings from Medicaid expansion. So at some point, there's a law of not only diminishing return, but no return. It's actually, as you said, the bucket's getting deeper and deeper. Do you think that, what is the first thing you would recommend doing?
I mean, certainly we need to look at reforming Medicaid expansion and freezing the Medicaid expansion because the federal government has $22 trillion in debt. So much. Louisiana was actually first in the nation in terms of the state most dependent on federal aid.
Yeah.
Okay?
Yeah.
Well, when the federal government has $22 trillion in debt, that federal aid has nowhere to go but down. And so right-sizing the Louisiana budget really looks at that. There are other structural things that Pelican Institute has looked at in terms of reforming the state budget, reforming, adding more to the rainy day fund, that sort of thing. But ultimately, we've got to scale back this Medicaid expansion and refocus Medicaid on the populations for whom it was originally designed.
It's just a tragedy to think that folks who really need this are put on a waiting list and can't get any help. I mean, or and they're the most vulnerable populations right there, developmental and other physical disabilities. So you quoted a study that said if the program were right-sized, letting people stay on their employer-sponsored insurance or keeping that coverage, that private coverage, that could really help as well. I mean, that could save the states quite a bit of money.
The Legislative Fiscal Office back in 2015 estimated that the state and the federal government combined, the Medicaid program would spend between $900 million and $1.3 billion over 5 years providing health coverage to individuals who already had insurance.
Wow.
Now, enrollment has been much higher than originally anticipated, so those costs could be much higher. Unfortunately, we've asked the Department of Health for some of the data they've had on this to try to quantify the impact and quantify the people dropping private coverage to enroll in Medicaid. The Department of Health, believe it or not, told us that a year and a half or so ago, they just stopped compiling the data.
Seriously?
Seriously.
Because they don't want anybody to know? They just don't want anybody to know what's going on over there?
You would have to ask. They said that the data weren't accurate, that the data,
now they supposedly they have put in a new system for getting better data, right? That's what they said.
Well, that's for eligibility. That doesn't necessarily for income. That doesn't necessarily report whether you had prior health coverage. Okay, The Department of Health said, well, they're only reporting people who had prior health coverage during open enrollment period. Okay, if that means if you didn't join during open enrollment period and you had prior coverage, you might not have been counted. In other words, they actually underestimated the people dropping private coverage to enroll in Medicaid, but the Department of Health still decided to stop compiling the data.
It's just unbelievable. And let's take a break. We'll come back. I want to talk about that issue of providers versus patients who are getting the Medicaid benefits. And there's been that argument between the two that, you're targeting the poor people. We want to get into that, Chris, when we get back. Okay, do you have a minute? We'll have one more segment.
Sure thing.
Can you stay for that? Okay,
Yep.
Good deal. We'll be right back with Chris Jacobs, who is a health Medicaid expert, actually, and has written some really important, has done some really important research on our Medicaid program here in Louisiana, and works with the Pelican Institute. And thanks to Daniel Esbromer with the Pelican Institute for getting me in touch with Chris. We'll be right back with Chris Jacobs after the break. Don't go away. All right, welcome back to the Ross Report. We have on the line with us Chris Jacobs, expert on Medicaid, all things Medicaid. Chris, let me tell you, I keep reading these things about, this is targeting the poor, and it's confidential tax data could get out and that sort of thing. That doesn't ring true to me. But I mean, it's the legislative auditor trying to get the information to make sure that people aren't ripping us off. How is that giving out confidential tax data and targeting the poor? I don't get it.
Well, for one thing, the auditor has actually had to sue the Department of Revenue to try to get access to these files and this data. I think the other point is, in terms of the poor, this is the problem we've seen with the eligibility scandal.
Yeah,
it wasn't the poor who were getting Medicaid.
Right, exactly.
Almost 1,700 people with six-figure incomes. At least one person reported an income of $145,000 per year. The Governor Edwards, only makes $130,000 a year.
So he could have applied for Medicaid too. The governor could have applied under those rules.
You have people making more than the governor on Medicaid. Okay, that's not low income in my book.
Yeah, and he said that Mr. Pepera said, the legislative auditor said, he has. He can compare some wage data, but he doesn't get it all. They're only looking at half the data, and then you have senators coming in. Why aren't we investigating provider fraud? But they do investigate provider fraud, do they not?
Sure, and it's two halves of the same whole. It's not an either or option. It should be a both and option, because you have seen in states with both with Medicare and with Medicaid significant improper payments. Those could be payments in the incorrect amount or outright fraud.
Yes, exactly, and that can come into the millions. I mean, that it's really just amazing, because they said the ineligible services, and Pepera said, our legislative auditor said, the millions could have been spent on people who earn too much to get that assistance, to get that health insurance, thereby really damaging the ability of the people who really need it to get it.
That's the ultimate point, is that every dollar taken, whether it's fraud, whether it's fraud by providers, whether it is individuals who have high incomes and shouldn't be receiving services, or frankly, whether it's people who dropped private coverage to enroll in Medicaid. Okay, every dollar spent on all those folks is a dollar that can't be spent, for instance, reducing the waiting list for individuals with disabilities, providing services to vulnerable populations, the populations for whom Medicaid was originally designed.
Wow. Well, we see this all over at every level of government, so much really waste and abuse, and it contributes, as you said, I mean, at some point that 22 trillion that we know of, it's probably more like 125 trillion in unfunded accrued liabilities, plus what we know. And at some point, the money flow is going to stop from the feds, and that's where I think Louisiana is going to be in big, big trouble. Chris, I appreciate you so much. Appreciate you taking your time to talk to us about this. You've really drilled down to it. I refer everyone to your article on the pelicaninstitute.org website. We appreciate all your information, all your research, Chris. Thanks.
Not a problem. Thanks for having me.
Take care. Bye-bye.